Hello, my name is Sarah Kleinwort. This is part 2 of the Preprofessional Requirements, and this is for the physician's requirements at the University of Iowa. Definition of a physician is a person who is legally qualified to practice medicine, a doctor of medicine, and a person skilled in the art of healing, one educated, clinically experienced, and licensed to practice medicine as usually distinguished from surgery. When I first started researching this project, I didn't know the difference between osteopathy and allopathy, and I didn't know which one I would want to choose. So I looked up the definition, and osteopathy, or DO, is a therapeutic system originally based upon the premise that manipulation of the muscles and bones to promote structural integrity could restore or preserve health. Current osteopathic physicians use the diagnostic and therapeutic techniques of conventional medicine as well as manipulative measures. So they basically use more of a physical healing than with drugs. Allopathy, or the MD, is a method of treating disease by the use of agents that produce effects different from those of the disease treated, so with the use of drugs. The University of Iowa, the MD school, in allopathy, there's 4 years of undergraduate school to get your bachelor's degree. Then you take the medical college admissions test, or the MCAT, before you can be admitted into medical school, which is 4 years. And after medical school is 3 to 7 years of specialty training at a medical residency. For the bachelor's degree, there are a lot of science classes and general classes that you have to take, like general biology and organic chemistry, biochemistry, physics, math, English, and behavioral sciences. Before you get into medical school, you have to take the MCAT. And the first year at medical school, there are a lot of advanced science classes, like biochemistry, gross human anatomy, cell biology and genetics, and so forth. The second year is mostly focusing on higher level medical classes, like pharmacology for health sciences, infectious diseases, pathology, clinical practice, and healthcare ethics, law, and policy. The third and fourth years are the clinical training. So like in the pharmacy degree, you had 1 year, but to be a doctor, you have to have 2 years. And it's 81 weeks of courses. The first week is a clinical beginnings class, and there's 65 weeks of required courses, and then there's 16 weeks of electives. Co-residency comes after medical school, and it could take 3 to 7 years, depending on the specialty field, and it is a paid position. As a summary, you first have to get a bachelor's degree, 4 years. Then you go to medical school for 4 years. First and second year are classes, like in the classroom, and the third and fourth years are clinical training. Then 3 to 7 years is the specialty training.